Hi, my name's Kelly Forbes, Senior Mental Health Practitioner with Newry and District GP Federation. Today we're talking about managing the transition of perimenopause and menopause. This talk is a brief version of all the information that we have put together on the evidence-based treatment, so there will be an attachment if you want the full information that we've put together. The first thing to say here is that this is not a list that we're presenting of everything that a woman should do. It's the wide range of treatments and approaches available. We really advise a woman looks at all the headlines, all the areas. You will probably have a gut feeling about where you want to send some energy towards, or what you want to trial, or where you want to make some changes. We advise that if you start something, monitor your symptoms alongside it so you can see if there are any changes. So the first one then, I guess the big headliner when it comes to menopause is HRT, so hormone replacement therapy. The science behind this is let's produce the hormone that the ovaries have ceased to produce, and then we can ease our symptoms and we can protect our health against future health conditions. The issue is with HRT, there was a study published probably about 15-20 years ago that proclaimed HRT is deadly and the damage was done. Women stopped taking it, medical professionals stopped prescribing it. We now know that that study was hugely biased, didn't report any of the positives, and it was with a very specific type of HRT, which was oral, so a tablet form, and it was non-identical HRT. So the ones that we use now are body identical, and they tend to go on with a cream or a patch. In the description, we've also attached for you the latest research in terms of the risks of taking HRT, so you can clearly see what they are. In short, if you are overweight, don't exercise and drink regularly, that will give you a higher risk of breast cancer than taking the HRT that I've spoken about. If it's something that interests you, take your symptoms, your symptom tracker, go and speak to your GP about it, and then you both can have a look at your specific medical history and decide whether you think there's any risks there for you taking it. The next one that I want to mention is the vaginal estrogen. Now, this is probably the area of symptoms that women don't talk most about. So this is the dryness down below, the stress incontinence, maybe the frequent UTIs, but really a sense of all is not well down there. So this is one of the symptoms of menopause that will not get better post-menopause, and a GP said a while ago that she wishes that every woman over 50 was on a repeat prescription for a vaginal estrogen, because it could massively help those symptoms. The next one we have is testosterone. Now, this is in our guidance to be available for women if their sex drive is really low despite having another type of HRT. So potentially testosterone can be added into that as well. The guidance with HRT is to start taking it when the symptoms start. There are other medications available which aren't HRT, so clonidine can be used for hot flushes. Birth control could possibly be used if there are real problems with the woman's cycle, so there might be really heavy bleeding or other symptoms due to the cycle, and the contraception might just level out that enough to help ease some of those symptoms through the month. And then we have our antidepressants. So if there's a mood element alongside the menopause symptoms, it might be that an antidepressant could be helpful alongside that as well. Now, a GP said to me a while ago, and I would agree based on the women that I see that come in to see me, very hard to unpick with women, is this perimenopause, is this a mood issue, or is this because they are so busy with life and situational stressors going on? But what we're saying is try something and then review the symptoms and see how you're getting alongside it. We're going to move on to lifestyle next. So lifestyle can reduce symptoms of the menopause. So the best experience women have is if they take a holistic approach to their symptoms, and I guess by that could be medication and lifestyle, or for women that don't want the medication, lifestyle changes in itself will help reduce some of the symptoms. The first one I wanted to talk about was a change in pace and needs. I certainly see a lot of women who come in to see me who are so busy, it's unbelievable, and because of that, I would highly suggest that they're having a very difficult time with their menopause symptoms. So we've got women that are working full time, family at home, running the house, maybe got elderly relatives coming into the mix as well. The science behind this is the hormone that's responsible for stress is called cortisol. So when we're really busy and running on all cylinders, that's the hormone that's being produced. Cortisol steals away hormones from progesterone, estrogen and testosterone. So they're all the hormones that are so important for women for their general day-to-day running of their body and mood. So if we're stressed, cortisol kind of bankrupts those other hormones, and then we can see a worsening of the symptoms. Now, a lot of women will say to me, I have not got time to make changes for me. And I think a lot of women, when we come into our 40s, we need to probably make some tough decision about what we're prioritizing with our health, because this probably won't get better if we continue firing all cylinders and burning the candle at both ends. There's a couple of authors that I really like, and they talk around we need to adapt our life to suit the changing hormone levels. That probably will involve slowing down, saying no more, delegating the running of the house day to day, learning how to do the bare minimum, and seeking that 1% of what you need. So if you need a whole day to yourself, how about you take 5 minutes to go and listen to some music when you leave work before you get home? They say to trust that you are changing, not to fight it, and there will be an end point. This is a transition. So moving on to exercise, research has shown us that the more you sit, the worse your symptoms are. So research has shown us that exercise will reduce our hot flashes, improve our mood, improve our sleep, and improve our brain fog, and also protects us against future health. Wow, if there was a pill for that, I think we'd all take it. So what are the recommendations? So if you're looking to really hit, what are the absolute recommendations? They're saying 3 to 5 times a week, 30 minutes to 60 minutes, whatever feels doable. And it's the 3 elements. So your cardio, and cardio is not marathon running, sweat pouring. It's a bit out of breath, but still able to have a conversation, probably a bit of a flush to the cheeks and a light bit of sweat. And then resistance, so that's your hand weights, your resistant bands, and then flexibility, so yoga, Pilates, any of those types of things. Please get rid of any Instagram models or quick fix exercise regimes, anything like that. Not helpful at all. The other bit with exercise is anything is better than nothing. It's about getting something consistent. So if it's something like a walk around the block with headphones in once a week for 15 minutes, do that. Do it every week, and then you will start to see some changes, and it's something to build on. Moving on to diet and nutrition. So research is telling us that if we're eating the right diet, this can reduce symptoms by up to 37%. So what does the right diet look like? It's following principles of the Mediterranean diet. So lots of plants, legumes, those kind of low glycemic index carbohydrates like your brown rice and your brown bread. It's saying to avoid sugar, because again we'll get a big energy spike and then that lull in energy and the worsening of mood. Avoiding processed foods, again they'll give us those energy spikes. And really with women, it's because the weight will start to go on a little bit more at this time in life for a lot of women. So again, do not get into these restrictive diets and cutting out food groups. For women, it's about little and often. That will help keep the mood and the energy regulated. And each meal is about having some sort of low glycemic index carb, like brown pasta or brown bread. You want some protein with that and some healthy fats, and then just as much fruit and veg as you can get in alongside that, and as much water as you can get in alongside that as well. The supplements that are recommended are vitamin D. So this is the one that we need sunlight to produce. So Everybody in the UK between the winter months is advised to take a vitamin D supplement, and if you don't get a lot of daylight hours over the summer, spring, then also just to take it all year round. The other one is omega-3, very important for brain and body health. If you eat oily fish, it's fine. I don't, so I need to take that one as a daily supplement for myself. Just a note on alcohol. It's really understandable. A lot of women, their energy levels are lowering, they're irritable, but they still need to get home, get the kids sorted or get the house in order. And I think some women will say that alcohol just gives me that washover and I just feel like I can carry on with the rest of my day. It's understandable, but long term it will worsen the hot flushes, it will worsen the brain fog, it will worsen sleep, and it will worsen mood. So if you are reaching more for the alcohol, reduce it, or if you need some help with that, speak to your healthcare provider who can link you in with services. I'm going to mention the herbal supplements. Now, we don't have the research to say that they're effective or they're not effective, but we certainly know a lot of women are using them and saying they are helpful, so certainly worth exploring them. The ones that have been shown to be helpful are black cohosh, ginseng and mac root, red clover isoflavones, St. John's wort and valerian root. So a health food shop would probably be able to give you a bit of advice on that. Moving on to sleep hygiene. So vicious cycle with this one, because perimenopause will impact your sleep and then your lifestyle choices can start impacting your sleep as well. So now is probably not the time in life to be staying up till 2 o'clock in the morning watching Grey's Anatomy, even though it's easy watching and it might be relaxing. We have to prioritise our sleep at this point in life. If you pop over to our YouTube channel, we have done a number of videos on how to improve your sleep, so do check those out. Moving over to managing mood, so this might be time to start exploring something called cognitive behavioural therapy. This is an approach that looks at how you're thinking and what you're doing and how that impacts your mood. It might be time to develop a mindfulness practice or start yoga, relaxation training, or journaling when you're just free writing at the end of a day. Perhaps you're just getting things out of your head onto paper. The science has shown us that that will help our mood. You might also want to start developing some self-compassion practice. We know that when women come more into perimenopause, that inner critic that tends to have its home in the week before we come onto our period, when we're having regular cycles, that inner critic can start getting really powerful through our perimenopause journey. There is also a shared experience of women. It's quite common for women to start seeking therapy at this time in their lives. And what we're hearing from women is that if there was any past hurts or betrayals or things weren't done, this can really come to the forefront at this time in our lives. So do speak to your healthcare provider, GP, about starting that process if you think that's something that would be helpful for you. Moving on to a positive mindset. So the research is telling us the better a woman's belief about menopause means the better her experience of it and the better experience she has of her symptoms. So for example, if you think I can't cope with this, I'm not the same woman that I used to be, everyone thinks I'm useless, that will have a really negative impact on your mood. And then look at the other side. I've got this, I just need to change things, I need to ask for support when I need it, this will come to an end. That will be a very different experience on your mood. So again, our YouTube channel shows you how to do thought challenging. You can learn how to do that there. You might want to start developing daily affirmations or a gratitude journal just to start really bolstering up that area. The other one is connected with like-minded women. So women that have a better experience of menopause are linked in with other women who understand what they're going through. We know that with mood, if you feel alone with any experience in life really, it can really make you feel worse. Partners will probably not understand truly what you're going through, but women of a similar age will know exactly what you mean when you say, I can't even think what that person's name was, or I just wanted to leave today and not come back. Other women will understand that and be able to validate that. So seek friends that are like-minded. 1,000,001 Facebook groups these days, and a lot of areas have menopause cafes now where you can go and speak to women about shared experiences. So the final one I'm going to talk about is menopause and work. 99% of women reported that work was negatively impacted by their menopause symptoms, and 59% of women had taken sick days because of their menopause symptoms. A lot of women were not going for promotions, reducing from full-time to part-time, which then has an issue on finances, and a lot of women taking early retirement because of their symptoms. So this is probably a two-way process. I think employers need to have menopause policies in place so they can support women to keep them in work if that's what women want. And women need to be able to talk about their symptoms confidently. Dr. Louise Newson has a lot about this in her book, particularly how to broach those conversations or think about what you need. So that's everything we had to share with you today. Please look at the resources that we've added for more information.